Hi everyone, my name is Dr. Risha Sharma. I am an Ayurvedic physician and a naturopath, and I specialize in autism spectrum disorders of children and hormonal problems in females. Today, I'm here to talk about craniosacral therapy, a very niche approach towards managing autism spectrum disorders in children in general. What is craniosacral therapy? I am not sure how many people have heard about this, but if you have at all, you know how powerful this therapy can be when it comes to nourishing and nurturing our central nervous system. What is our central nervous system? It is a combination of our brain and the spinal cord that comes down from it and ends at the sacrum. And this is what from where all the nerves of our body traverse through different parts of the body and affect different organs, different body functions, physical, emotional, and all of those aspects of the body are regulated by a central nervous system. So we can deeply affect the functioning of the central nervous system through craniosacral therapy in the most gentle way possible. We use just 5 grams of pressure, yes, just 5 grams of pressure to modulate the pressure inside the cerebrospinal fluid, which is a fluid that runs in between the layers of the outer covering of our brain and spinal cord, which gives it a buoyancy effect to keep it in place inside the skull and the vertebra. And that buoyancy effect helps in proper messaging, proper neural transmission, proper growth of the brain, especially when we talk about children. It is said that craniosacral therapy should be taught to midwives, nurses, and usually caregivers of children because in the growing years of life, especially during childbirth, there are certain traumas that the child may experience during the birthing process itself, or they may have absorbed it through the 9th month inside the womb. So if you do craniosacral therapy on a newborn child, you can actually release minor restrictions that can become major issues later on in life. It can include not even developmental problems, but also gut issues in children, colic issues, children who throw up a lot of milk, or sometimes postural issues, delayed milestones. There can be a myriad of problems that can affect the growth of a child due to restrictions in the cerebrospinal fluid somewhere in the brain or the spinal cord. Through craniosacral therapy, we are releasing these restrictions with the gentlest pressure of just 5 grams and helping the brain pick up its natural pace. For example, a child who has speech delay has some kind of restriction, may have some kind of restriction in their prefrontal area or the speech area, Broca's motor speech area. Through craniosacral therapy, I have seen many children on the spectrum with speech delay improve and catch up on their speech delays thanks to craniosacral therapy's release of restrictions in the cerebrospinal fluid. Now, to say that this therapy alone helps the children in catching up their milestone would be a little unfair. Sometimes it is very obvious, other times you need a combination of biomedicine, some nutritional management, detoxes that go hand in hand with craniosacral therapy. And with this concoction, we have seen great results in a lot of autistic children. In my experience, in the 8 years I have worked with autistic children in Singapore and now in India, I have seen great results in autistic children in terms of improvement in their speech, improvement in their behavior, management of hyperactivity, management of constant anxiety, and management of a lot of focus related issues, writing problems, learning problems, social and behavioral aspect of autism, wherein children are not very open or comfortable socially. After taking some sessions of craniosacral therapy, children relax and the anxiety settles down and they are more open to change, more accepting of the change in the environment, and that makes the life of us parents much easier when we are trying to provide the best of care to our special needs children. This is where craniosacral therapy is so helpful and so gentle, because we need something which is as gentle as that can be used on a newborn to help our children with special needs. Now, to talk about the spectrum of this therapy, I use it on my patients who have hormonal problems. I have patients who come to me for anxiety release, and they say that after one session they feel that their brain is empty. I have people who come with a lot of emotional dysregulation, and after a few sessions of craniosacral therapy, they feel more sorted, they are able to focus more, they are able to regulate emotionally and mentally much better. So this is kind of a mental detox, you can say, for people. And I usually recommend it, like if you have an autistic child or a child who has some kind of developmental delay, or your child has cerebral palsy or even Down syndrome, where in any kind of developmental issues of children where the neurodevelopmental aspect of the brain is involved, craniosacral therapy can help. Now, coming to how this therapy is done, how long it is, and how often it is done. So I recommend a general rule of twice a week sessions of 30 to 45 minutes for autistic children. We usually start with smaller sessions because we know children take time to settle down, and usually in a matter of 1 to 3 sessions, children are able to feel secure enough to lie down on the therapy table, and then I work on them with my hands and apply 5 grams of pressure, the pressure that is the size of the smallest coin in our currency. So that much pressure helps modulate cerebrospinal fluid inside the meninges, the brain coverings, and helps regulate the development and functioning of the different brain areas and the spinal areas. So it's usually a 30 to 40 minute session, which is very relaxing. A lot of children pass out on the bed, that is, they fall asleep, and so that it is that relaxing. And it is also seen, I have seen a lot of children, there's a release of constipation as well as a result of the release of the restrictions in the spine and the nerves in the. In my experience in the last 8 years, I haven't seen one patient who didn't see like any change in their health after taking sessions of craniosacral therapy. So it is worth it. It is worth giving a try. It is very gentle. There is just 5 grams of hands pressure involved. No machines, no electric shocks, no testing is required. This is as gentle as it gets. So definitely give it a try. I have my clinic in Chandigarh, and if you want to book a session with me, you can DM me here or email me at the email address below. For more information, you can always text me on my website www.wishfulhealing.com, or you can call me on this number for more details on the biomedical treatment of autism coupled with craniosacral therapy.